Okay, today we're going to talk to Tom Graham. And first of all, thank you for sitting down with the Owl Falls Historical Society.
Glad to do it.
Now, where were you born?
Detroit, Michigan. Grew up in St. Joe, Missouri. Christian Brothers High School, St. Joe, Missouri. It was an all-boys school. In St. Joe, they had Christian Brothers was the boys' school, and then they also had a convent school which the girls went to, which was run by a nun, an order of nuns. I can't remember what order it was, but my mother sent me there in the first grade, and they taught French. There was some French order, and I could speak a lot of French in the first grade. And then they kicked all the boys out, and we went to other schools after that. So I never learned any more. Softball and basketball. I went out for football and it was the year we had an excellent football team at our high school. And I remember I was a defensive guard, and the guy across from me was all-city state offensive guard. And I spent all my time laying on my back looking at the sky because this guy just knocked me kooky. And we had a running back that weighed 225 pounds. He was a fullback. And our high school basketball team was a pretty good team. We had, we didn't think much about it, but we had two forwards that were 6'9". In those days, you didn't think about, that was pretty tall. Had three brothers. My one brother, Patrick, died when he was 4 years old, and I was 7. We had scarlet fever. And there were no antibiotics in those days, so he got worse. He got pneumonia and died. And then I had two other brothers, John and Al. I remember the coupon books that you had to get, to get different types of food, to get butter, to get sugar, to get things. You had to have coupons, and everybody had coupon books in those days. We didn't have a car, so we didn't worry about gasoline. My mother was primarily a housewife. She had, 3 boys at home to take care of, and then my dad was in Ladies Ready to Wear. He would go to New York to buy clothing and things for shops. When he was 38 years old, he got multiple sclerosis, and he was completely paralyzed from then on until he died at age 56. My mother thought I was goofing off too much, so she got me a job at the local hospital, working in the central supply department at the hospital. So I did that starting my sophomore year at high school. And that's how I got interested in medicine. Because we used to, in those days, we sharpened needles and reused them. We cleaned syringes. We cleaned IV tubings. Everything was reused. There was no throwaway plastic stuff in those days. They hadn't come up with the disposable syringes or disposable needles or disposable IV tubing in those days. And I part of my job was I hauled the oxygen tanks around to the patient's rooms, because in those days they didn't have piped in oxygen. You had to take a tank on a cart and wheel it to the patient's room to hook them up. I got very interested in medicine because of that, because of working at the hospital. Went to Creighton and Omaha. There were 2 or 3 doctors in St. Joe, Missouri that had graduated from Creighton. And I was interested in that and in medicine, and I thought that would be a good place to go, so that's why I went to Creighton. It wasn't that expensive in those days. I think a semester was only like $150 or something like that, but so it was very reasonably priced. I lived in a dormitory, and I was 3 years in pre-med and 4 years in medical school. So I was there 7 years. In those days, you could get in after 3 years of pre-med, where now they have to take 4 years of pre-med to get into medical school.
Were you a good student?
Fair. I liked the biology sciences. I liked those. I took a lot of those, and I did very well in them because I liked them. While I was going to school there, I worked at Douglas County Home for Boys that were in trouble. It was kind of like a country home where the boys that they were caught stealing or anything, why they would send them there and keep kids that didn't have parents and things like that. And I would take care of them, play games with them, and I slept in the dorm with them at night, so that they wouldn't. And then if they ran away, I'd try to catch them. I remember one ran away. They did that occasionally. They would run away. This place was down by the river in South Omaha, and this kid ran away, and I tried to catch him, but he hid away somewhere and it was all rolling hills and woods and stuff, and so I never did catch him. But I think the police got him later and brought him back. Myself and four of my classmates, all five of us went to the same hospital in Kansas City, Kansas, and it was really it was nice. It was a nice hospital, and it had a bunch of really nice doctors that taught us a lot of things. I thought I wanted to be a specialist in OB and GYN, so I went to Dr. Goody had gone to Lafayette, Indiana, in a surgery residency, so I went there in an OB residency, and I was there for 5 months. I delivered a lot of babies, did a lot of circumcisions, had a lot of interesting cases, but they really weren't teaching me anything, and I was kind of getting bored. So that's when we decided that we'd go and practice.
That you and Dr. Goody would go in your...
And Dr. Dunley, the three of us. We all three got together and decided we'd like to find a small town with a small hospital and a place where we could practice. She was a student nurse at the main hospital, St. Joseph's Hospital in Omaha, and they would have dances, and they would invite everybody to come, and that's where I met her. Well, that would have probably been in 1952, probably. She was from Fort Dodge, and she came back and worked at the hospital in Fort Dodge, and then we got engaged and got married in 1956. Yeah, I knew them before. I knew them in pre-med before we ever got into medical school. Dr. Dunley was from out in western Nebraska, and Dr. Goody was from Nebraska City, Nebraska. But I met them in Omaha at Creighton. We had a plan to go together. We all interned together. We all went to medical school together. We graduated together, and we interned together in Kansas City. And we just decided while we were there that we all wanted to practice together, the three of us. And then we were looking for a small town with a small hospital. And my wife's father, we looked, there were catalogs, and we looked at Knoxville, had a guy built a clinic building there for 3 doctors. We looked at that. There was also one in Decorah. My father-in-law was in the hospital in Fort Dodge, and a detail representative called on his doctor. And the detail man told his doctor that there was a doctor in Iowa Falls that was looking for some doctors to come in with him. And we didn't think much about Iowa Falls at that time, so we went to Knoxville, and the guy at Knoxville, the doctor at Knoxville, said, "I'd be delighted to have you guys come here, but I own the hospital, and you'd have to go take your patients 50 miles away if you wanted to practice here." And then we never got to Decorah, but Art Burgess kept calling me and calling me and calling me. So we thought, well, on our way to Decorah, we'll just stop here say hello. And he gave us a tour of the town and took us to the Princess for supper. And we fell in love with Iowa Falls. And we brought our wives back a month later, and they thought it was great too. And so that's how we got here. See, Dr. Goody and I were in Lafayette, Indiana. He was in surgery residency and I was in OB. Dr. Dunley was in Kansas City, and he stayed in Kansas City and was in a surgery residency where we interned. So the three of us met in Iowa, and then we came here. And liked Iowa Falls very much. We knew it wouldn't be easy, and that we'd have to work, but we just loved Iowa Falls when we saw it. You know, the streets were wide, the Princess Cafe was nice, the river was beautiful, you know, the school system was great, everything was really nice here. I came in March of '58, and Dr. Dunley came in July of '58, and then Dr. Goody didn't come until he finished his residency, which was in '61 or '62.
Okay.
Yeah. And Dr. Burgess' office is where Tom Marsh is now. That was Burgess's office. And he would leave in the spring. You know, he'd leave the first part of May and go to Canada and stay there till October. And so we were there by ourselves all summer. So I used to, we weren't very busy. I used to sit and watch American Bandstand every afternoon because there was nothing else for me to do for a while. Yeah, he had an excellent nurse, Dr. Burgess did. Her name was Jo Jewell. She was one of Earl Bailey's daughters. Patients would come in and she'd say, well, wouldn't you like to meet the new doctor? Oh, no, Joe, you can take care of me. You can take my blood pressure. And Art Burgess dispensed medications in those days. And so she'd refill their medicine for them and take care of them. And I'd watch American Bandstand. Dave Craig had a pharmacy in Radcliffe. And he asked us to come down to the clinic that they had there in Radcliffe. So we went to this, we would go every day, Monday through Friday, to this clinic in Radcliffe and see patients there. And we did that for about 10 years. Everything changes with medicine. Everything changes, it gets different as you go along, you know, over the years. The way you treat different diseases, the way you treat high blood pressure, the way you treat heart disease. You know, in the old days, if you had a heart attack, say when I started out, it was very common for the person to be laid up for 6 weeks. You know, they'd be in the hospital in intensive care for a couple weeks. Then they'd be in a rehab type program, you know, and unfortunately, a lot of times at the end of all that time, you'd think they were well, and then the guy would go and take a shower and drop dead in the shower or something, you know. Where nowadays, if a person has a heart attack, they immediately go to a hospital that has cardiology services where they do angiograms, and they go in and they find the blockage and they clean it up and they put stents in. And the big change there was from just watching people and trying to get them better and very fast movement, getting them to a special cardiac unit right away to save their heart muscle, you know. So it's an entirely different way to do things. And most of the time it was house calls were for chronic illnesses or high blood pressure or they didn't know what was wrong with the patient and we made house calls, but nowadays when you need blood tests and you need x-rays and you need different things, it's better to have them come to the hospital and be seen in the emergency room, and then you can you can better diagnose them with lab tests and with x-rays and so forth. Nobody ever thought about transplanting kidneys or transplanting hearts or transplanting lungs and things like that. And they do all that now, which in special hospitals they do that, you know. But I have atrial fibrillation, and I've been going to Mayo Clinic and they've got me on medicine. But if the medicine doesn't work, they can do what they call an ablation. They go in and they destroy the AV node so that it doesn't cause you to have this irregular heartbeat. Now, so they do a lot of different things, you know, especially cardiac-wise. You know, if you, like I said, you get people that have heart attacks, you get them right to a center where they can look at their heart. You know, they can scan the heart. They can put catheters in the heart. They can take blood clots out of the heart. They can, you know, they can put stents in there. They put these metal stents in that open the arteries up, you know, to prevent loss of heart muscle. You know, and they transplant kidneys. They transplant, you know, and like you said, they can sew on arms and legs now. And I see this program on TV where the soldiers that get blown up over in Afghanistan, a lot of times they lose their leg or they lose an arm or lose something like that. And in the Second World War, if that happened to a lot of those soldiers, they just died. They never survived. They couldn't save them. You know, they'd be gone. The hardest thing was to tell somebody that they had a really bad disease or they had cancer and they were going to die. That would be the hardest thing you had to, you know. Or you had patients in the hospital and they just wouldn't get well, and you had to comfort them as best you could, you know. Well, you know, you had to go in and talk to them about what was happening to them, what was going on. And a lot of time it was older people that had cancer or had something like that, you know. And they were very, most of the people are very knowledgeable about how bad off they are, you know, or whether, a lot of them knew ahead of time that things were not going well and that they weren't going to make it. And so you just had to be as comforting as you could be, you know. You know, I did family practice and I loved it, but I jokingly said I should have gone into dermatology or radiology. In dermatology, if it's wet, you put something on to make it dry. If it's dry, you put something on to make it wet. And the patients always keep coming back, and they never get well and they never die. Well, I loved delivering babies. I did. I really enjoyed delivering babies. You know, and delivering babies, you had was a wonderful, joyful time when you had a nice, healthy baby. And if you had one that had something wrong with it, then it was a very sad time. You know, now you've got ultrasound, and the ultrasound now is really fantastic. They've even got a 3D ultrasound where you can actually see the baby's face and body and everything. It's unbelievable, the stuff they can do now. There's a lot of mothers work nowadays, you know, and if their child is sick and they don't know whether they could go to work or whether they should stay home, they would bring the kids in early and I'd check them over, and if they weren't too bad, why then they could go home or they could go to school. You don't want to send a sick kid to school. Or I'd tell the mother, you better stay home, this child is really sick, you know. So it worked out really well. I liked doing it, and it wasn't a real problem. You know, when I started out, we had very few blood pressure medicines. You know, I can remember that the Diaril and chlorothiazide were the first big. When I was in training, when I was a student, we had a clinic at Creighton where we took care of people, and all we had in those days was phenobarb and mercurhydrin to treat high blood pressure. And then they invented Diaril, which is a hydrochlorothiazide type drug, and that was like a wonder drug because it really did help people with blood pressure problems. And of course, the only antibiotic we had when I started out was penicillin. You know, and then acromycin came along, and then some of the other then just it seemed like every year there was a new antibiotic that came along to help people. So those were the big changes: the treatment of high blood pressure, the treatment of infections.
But what goes through your mind when you think, "Oh man, I've got to save this child or this person because they're my neighbors"?
Well, you do. You feel bad for them that they got a problem. That's what the big thing is. But you have to treat them like any other patient. You have to evaluate them and see what their problem is and treat them. That's all. You can't, even if it was your brother or somebody else, you can't sort them out. You have to treat them as if they're a regular patient. But there were times like that when you get really frustrated. And the most frustration was if you had somebody and you treated them and you told them what they needed to do and then they didn't do it. Then they either didn't take the medicine or they didn't listen. They did any damn thing they wanted, and that was frustrating. That was probably the toughest part because my wife always said, "Well, you were never here when those kids needed you to do such and such and such." But I tried to get to all of their school activities, their dance recitals and their musicals and proms and those things. But a lot of times I get called out and I wouldn't get there to do it. Oh, probably 8 in the morning. Sometimes I wouldn't get home till 8 o'clock at night, 8 or 9 at night. It was funny because, we used to have a clinic we'd be open on Saturday, and a lot of times we'd be there till 2 or 3 o'clock in the afternoon on Saturday. We're always supposed to be open from morning till noon, but we'd be there till 2 or 3 o'clock in the afternoon. And I missed out on some of the things that my kids did, because of that. When we got the beeper system, and they could beep us. You could go, but you were, if that beeper went off and they said call the hospital, well then you had to go. But that helped a lot. I know the first few years we were here, all three of us took call every day. We took call every night. All three of us did. Dr. Goody, Dr. Dillon, and I. And finally, after a few years, we looked at each other and said, if we don't alternate this call system, we're going to have to leave. We can't stand this. It's just terrible. We can't keep this up. So that's when we switched over to alternating call, So we weren't on call every night. I got to tell you a funny story about that. Don Wilson was a hospital administrator here. And he called up one day and he said, say, I've got a doctor over here who is interested in looking for a place to practice. Are you guys interested? We said, send him right over. So he sent Dr. Brunkhorst over. And I don't know if you remember Brunkhorst, but he had that like an afro hairdo, and he was a typical California guy, and we talked him into coming and joining our group, and that's what he did. But he went on a trip. I think he went to Germany to visit relatives first, and then he came and started practice. but we grabbed him as quick as we could. The young doctors now are very well trained. They're very knowledgeable about what to do for patients. Some of them have a different attitude. They want to work 8 to 5. They don't want to take any call. They don't want to do any emergency work. They don't want to deliver babies. And I don't know if it's part of their training or what, but it was different for us. You know, we did all those things, and we're happy to do them. But they just don't seem like they want to do that anymore, which is perfectly their prerogative, you know. Pretty much, I think so, and I think they make a good living, but they don't make the big bucks like they do in Des Moines and Waterloo, and you hear about these doctors that make millions of dollars. I don't think the family practice guys don't do that. They don't do that. Well, she has to, with the kids, you know, her whole life is monitoring the children and taking care of the children and disciplining the children, and not getting a lot of relief from her doctor husband. My girls were all in gymnastics, you know, and I would go to the gymnastic meets. Sometimes I would get so I could go out of town with them, and sometimes I couldn't, you know, and Denny was in sports, you know. He played football, he loved football. I remember I had we'd go to the games, you know, I'd go be on the sideline as a doctor. I remember I think he got hit, he got a stinger in his neck, and so I took him out of the game, and he was mad at me for 2 or 3 days because I did that. Oh yeah, well, of course I love Iowa Falls. I've always enjoyed Iowa Falls. I enjoy the people that live here. I enjoy all the community activities. I'm not so sure about the new hospital. I think it's kind of downsized, and I'm really not as in favor of it as some people are, but they'll have to survive with it one way or the other, you know. I think we've got a really good hospital already. We've got a good clinic building, and I don't know what they're going to do with those buildings when they go to the new place. I mean, you know, they're not going to have a nice big clinic building out there like they have down here. I don't